Come on up, girl. Good afternoon. The Committee on General Government Operation, Appropriation, and Housing is now called to order. For the record, today is Monday, July 13, and the time now is 5:03. Notice for this budget hearing was disseminated via email to all senators and all main media broadcasting outlets. First public notice was issued on Monday, July 6th. Second notice was issued on Thursday, July 9th. The committee will hear and accept testimonies on Bill 282-35 LS, the Fiscal Year 2021 Appropriation Act as requested by the Governor, relative to the Department of Correction Fiscal Year 2021 budget request. I'd like to acknowledge the senators that have joined me today. I have Senator Amanda Shelton, I have Senator Jose Pito Churlay, the Oversight Chair of the Department of Correction, and I have Minority Leader Senator Tello Tadigui. This budget hearing shall be as follows. Those testifying on behalf of the department will be recognized by myself and invited to the panel, and I have invited the panel. Mr. Carbolito is here, the director. Written testimony shall be submitted to the committee. Please provide my legislative staff with written testimony for photocopying. Testimony may be read, and lengthy testimony should be summarized. Testimony shall be confined to the substance. I remind my colleague, we're here to discuss budget 2021 for the Department of Correction. We may ask some question, not a whole lot, on 2020, but everything is focused on 2021. Individuals will be allowed to present oral testimony. Once you're done, you are asked to remain in the room for further questions or for additional testimony as may be desired by members of the committee. Proper form and decorum shall be practiced by all present in the public hearing room for these proceedings. Individuals who fail to maintain proper form and decorum may be restricted from providing oral testimony and or may be asked to leave or be escorted or removed from the room. When you speak, please make sure that the microphone is on and that you speak into the microphone. You would please state your name and the title for the record. I ask at this time that the panel members from the Department of Correction to rise and for our sergeant at arms to please swear them in. Good afternoon, Mr. Carbolito. If you could please identify yourself, your name, your title, and the staff that you have with you, her name and her title. Yes. And then you may begin your testimony, sir.
Thank you. Sure. Joseph S. Carbolito. I'm the acting director for Department of Corrections. And to my left is my administrative services officer, Ovita Nauta. Okay. Buenas and half a day, Mr. Chair, San Agustin, and members of the Committee of General Government Operations, Appropriations, and Housing. Thank you for the opportunity to present the Department of Corrections Fiscal Year 2021 budget request.
Sir, if you have any slides, did you want to present?
Oh, yes. It's,
all right.
We submitted it, right, Ovi?
There you go. It's on the screen now. So you can go ahead and begin, sir.
Okay. The Department of Corrections is seeking FY 2021 appropriation level of $27,897,968 for its overall operations. The sum of $26,926,627 is requested from the general fund, and $971,341 is requested from the Corrections Revolving Fund and Safe Streets Fund. Approximately $18,857,825 is for personnel, and $892,001 for overtime, and $7,176,801 is for operational costs and utilities. An estimate of 60% of the operational costs under the Corrections Revolving Fund are for service providers to provide medical services to inmates and detainees. The remaining are contractual services, supplies, and equipment costs for DOC to provide support to the department in meeting its core duties and responsibilities. Pursuant to 9 GCA Chapter 90, Article 1, Section 90.15, which states the Department of Corrections is to A, protect the public from the destructive action of law offenders through control and rehabilitation, and B, it shall provide staff services for the judiciary, the parole board, probation officers, and interested agencies of the executive branch. The department's mission is the prevention of escape, to maintain order and ensure a safe and humane environment for those who are required to keep in custody, to protect the public from their destructive actions as law offenders. Maintaining a safe and orderly institution is only possible through the compliance of rules and regulations and sufficient funding to sustain operations and improve existing resources such as a strong workforce, sufficient equipment, and adequate facilities. The goals and objectives of the Department of Corrections is the protection of the public by the safe and orderly operation of the institution by maintaining order and providing the programs for the rehabilitation of the inmates and those committed to our custody. The Department of Corrections accomplishes its mission by fulfilling its legal obligations to ensure that all inmates and detainees have adequate access to routine and emergency medical, dental, and mental health care. In FY2016, a cooperative agreement between the Guam Memorial Hospital Authority and the Department of Corrections for medical services was established for pharmacy, nursing, and physician services. Medical supplies was also entered into the MOA to meet the requirements set forth in the District Court order dated January 16, 2015 in the United States of America versus the Territory of Guam, civil case number CV 91-00020. Adequate access to routine and emergency mental health care was also addressed in FY 2016. DOC entered into an emergency mental health care was also addressed in FY16. DOC entered into an employee contract with a clinical psychologist to ensure compliance with the standards for healthcare, for health services in jails established by the National Commission of Correctional Healthcare. In 2015, a memorandum of understanding was entered into with the Department of Public Health and Social Services to provide routine dental care to inmates and detainees. DOC's goal is to provide quality health care to inmate and detainee patient under its care and custody consistent with the standards of health services in jails established by the National Commission of Correctional Healthcare and community standards by maintaining these agreements, memorandums, and contracts entered with GMHA, clinical psychologists, and DPHSS. Additionally, DOC ensures that inmates and detainees also have access to specialty care, which includes, but not limited to, hemodialysis, optometry, surgical centers, and GMHA emergency care. Okay, you can go ahead to go to the next slide, please. Administration Division. This is under the Director's Office. The Director's Office of the Department of Corrections provides oversight, supervisory, and directional control over the administrative and operational activities of the department. Under the direction of the Director of Department of Corrections, DOC personnel ensure public safety for the people of Guam and safety and control of inmates and detainees in DOC custody. The Admin Division under the Director's Office is responsible for managing the output of administrative support services, which involves the following: finance services. This complies with the fiscal budget within the parameters of the budget law. It ensures that all needs and services are funded, and it monitors and administrative support to ensure compliance. Personnel services. This unit plans and coordinates the process of employee benefits, administer employee management relations, such as leave sharing, performance evaluations, employee grievance, and adverse actions. It keeps abreast of personal rules and regulations, maintains personal records. Payroll Services. This is responsible for the processing of the department's timesheets and other payroll-related matters. The Supply Services is responsible for the procurement of supplies, equipment, and capital and contractual services. Go ahead, next slide. A total of $3,361,344 is requested for the Director's Office for its fiscal 2021 operations from the general fund to fund salaries, benefits, and overtime for its current staff of 4 unclassified employees, which includes the director, deputy director, private secretary, and a clinical psychologist. It also has 8 classified positions, including the administrative services officer, personnel officer, administrative assistant, program coordinator 3, payroll clerk 2 clerk 3s, and a messenger clerk. The $261,648 is requested for operations, which covers fuel, office supplies, drug testing, miscellaneous clothing allowance for uniform officers. Utilities cost of $2,068,200 is requested for the department's telephone, power, and water services. In order to meet the budget ceiling, there is none for capital outlay this fiscal year. Go ahead and move to the next slide, please. DOC is requesting to fill the following positions.
Next slide.
Next slide. Next slide, please. A property and supply management officer. This is currently being performed by a corrections officer. A refrigeration mechanic, a plumber, automotive mechanic, an electrician. These are all performed by inmates, supervised by corrections officers. Computer systems analyst 1. This is done by collateral duties performed by corrections social worker 3, a parole officer 2, and a corrections major. If filled, they would remove the other civilian staff and security staff assigned to these duties and allow better administrative support to over 200 DOC employees. Go ahead, next slide, please. This is our operations division. The Adult Correction Facility and the Hagåtña Detention. The Adult Correction Facility and the Hagåtña Detention Facility are responsible for the administration of security, control, custody, and care of adjudicated inmates through regulated procedures. The major objectives are to protect the life and property of the people of Guam through 24-hour security services and supervision of prisoners. 2, protect the lives and health of prisoners through strict adherence of rules and regulations governing sanitation and facility safety. 3, maintain custodial control of each prisoner while inside or outside the compound. 4, ensure deployment of adequate manpower per platoon shift for the prevention of prison disorder. 5, enforce disciplinary sanctions to inmates in violation of institutional rules and regulations. And 6, regulate and enforce institutional rules and regulations to visitors entering the facility. A total of $16,486,728 is requested for both the Adult Correctional Facility and the Hagåtña Detention Facility for its FY2021 operations from the general fund to fund salaries, benefits, and overtime for a total of 202 uniformed corrections officers. This is including the warden, majors, captains, lieutenants, detention facility guards, detention facility armed security guard. Approximately $844,717 is requested for overtime. This amount may not be sufficient for FY 2021 fiscal year should there be a shortage of manpower due to the attrition rate, the military deployments, and weekend drills, personnel on leave and personnel health profiles. However, the department would do its due diligence to minimize overtime. Next slide, please. Uniform personnel. In 2018, we had 196 officers and lost 35 officers to resignations, terminations, dismissal, retirement, lateral transfer, separation by death. In FY 2019, we had 226 officers and lost 11 officers to for the same reasons. In FY 2020 to date, we have 202 officers, 202 uniform officers, and we lost 22 officers so far. When I assumed command at DOC, the staffing of uniform officers was about 150. Currently, we have a corrections command staff. Go ahead and go to the next slide, please. We have a corrections command staff of about 6. That's a colonel, 2 majors, 1 captain, 2 lieutenants. And these officers manage 202 uniform officers, inclusive of corrections officers, detention guards, armed security guards, and an estimate of about 670 to 700 prisoners, 24 hours a day, 7 days a week. The justification of the filled FTE positions and staffing needs. Currently, recruitment is in progress, and interviews are being conducted for 19 corrections officer 1 positions. Also, DOC is pending approval of promotions for 35 uniform officers. In FY 2019 and FY 2020, 22 corrections officers have left the department through resignation, retirement, lateral transfer, and so forth. About 74 GG1s for Corrections Officer 1 and 2 Parole Officer 1 positions have cleared BBMR and the Department of Administrations. We have 51 that's on board, and this includes several reemployments, and the rest are pending completion of the recruitment process, such as the background investigations, polygraph, psychological tests. In addition, about 12 GG1s for civilian positions have cleared BBMR and DOA and are pending completion of recruitment process. It's noteworthy to mention that the recent increase in manpower level was made possible through emergency recruitment in FY 2019. This was supported by the Governor of Guam, and this was to alleviate the increase in workload demands on current staff caused by the loss of employees. However, DOC still needs additional corrections officers to fully comply with its post-unit manning requirements and to minimize overtime and mental stress on its employees. In summary, of all the officers and the assignments where they're at, we have 49% or 98 uniform officers at the Adult Correctional Facility in Manila. 13% or 26 officers is assigned to the Agustin Detention Facility. 5% or 10 uniform officers is assigned to SORT. 6% or 12 are recruits. That equals to 73%. The remaining 27% is spread out to the other support services, as you see up there in that slide. Okay, moving on to casework and counseling services. The mission of Casework and Counseling Services Division is to reduce recidivism by providing case management services to inmates so that upon release from prison, they do not return to criminal behavior and become a contributing law-abiding member of society. This is accomplished through effective case management, supportive counseling and treatment, and release planning and community reintegration. Case management begins at admission to the facility, throughout incarceration and reentry to the community. This assesses inmates for risk levels, develops, evaluates, and analyzes program needs and other data about inmates, evaluates progress of individual offenders, coordinates and integrates inmate training programs, develops social histories, evaluates positive and negative aspects of each situation, and develops release plans. The vision of our casework and counseling division is that every inmate will receive an intake assessment and a case plan to guide their successful confinement from time of incarceration to exit from our facility. CCSD will promote, recruit, and maintain motivated, competent, and qualified staff to provide quality results-driven case management services to all persons serving time in our facility. Our staff will be provided the tools and equipment necessary to meet our division mission and will receive supportive training and guidance to promote their professional growth and development. A total of $800,066 is requested for Casework Counseling Services Division for its FY21 operations from the general fund for about 10 corrections social worker personnel. That's one administrator, one supervisor, 3 social caseworker 3s, 3 social workers 2, and 1 case social worker 1, and 1 clerk 3. The staffing needs is a promotion from current personnel and hiring of 4 more social workers to corrections social worker 3, 1 corrections social worker 2, and a full-time chemical dependency treatment specialist 2. Next slide, please. Moving on to our mental health division. The mission of our mental health division is it provides mental health services to prisoners that are ethical, efficient, adequate, effective, accessible, and timely, meeting the National Commission on Corrections Healthcare standards of mental health services. The vision of forensics mental health is to provide treatment to prisoners diagnosed with mental illness, which will empower them to function more independently, responsibly, and with self-control, thereby increasing the safety and security within the facility, as well as providing patients with the skills and abilities to prepare them for successful reentry into the community. The budget, a total of $388,464 is requested for forensic or mental health division for its FY2021 budget operations. This is to fund 6 positions: 1 psychiatric technician 2, 1 psychiatric technician 1, 1 psychiatric social worker 1, 1 psychiatric social worker 2, 1 psychiatric social worker 1, and 1 chemical dependency treatment specialist 2. The staffing needs, we need 1 chemical dependency treatment specialist 2, 1 psychiatric social worker 2, and 1 psychiatric social worker 1. Go ahead, next slide, please. Moving into our Parole Services Division, the mission of the Parole Services Division is to protect the public from the criminal elements of conditionally released adult criminal offenders on the island of Guam. The Parole Services Division is responsible for the enforcement and administration of parole laws, Government of Guam and Department of Correction rules and regulations in accordance with Title IX, Guam Code Annotated, Chapters 80, 85, and 90, and any other applicable laws germane to parole matters. The major objectives are to protect life and property from the criminal elements of conditionally released adult offenders paroled by the Guam Parole Board, mandatory releases, courtesy off-island supervision, or released by the courts. In order to accomplish the parole mission, the division had requested an infusion of additional parole officers positions to assist in obtaining meaningful results in contacting parolees, thus resulting in lower recidivism rate and a clerical position to assist in the administrative duties of the division. A total of $1,043,71 is requested for Parole Services Division for its FY 2021 operations from the general fund for 12 parole officers, to include the Chief Parole Officer, 3 Parole Officer 3s, 4 Parole Officer 2s, 3 Parole Officer 1s, and 1 Secretary Typist position. Next slide, please. Next slide. The DOC Medical Clinic. Under the DOC GMHA Consolidated Cooperative Agreement, GMH provides basic medical health services to all prisoners for both the Hagåtña and Manila facilities. The MOU between GMHA and DOC, it's agreed upon that $3,375,146 per year for GMH to provide basic medical health services to all prisoners. Contractual services. Next slide. Food services. For FY 2021 budget request, it's at $2,415,947,000. In FY 2020, the food services was appropriated for $2,469,941, which is a difference of $53,994. A 3-year contract was awarded through an IFB and took effect April of this year, 2020. The other contractual services, as mentioned earlier, is the DOC GMHA Consolidated Cooperative Agreement. For FY 2021, we're requesting $2,431,006. In FY 2020, the funding for GMHA Consolidated Agreement was covered by a Department of Interior Compact Assistance Grant. So the difference of the difference and the shortfall would be $944,140 from the original agreement amount to the FY21 request. Dental, DOC is requesting $60,000 in supplemental funding to address the dental needs for DOC inmates and detainees. Although the cooperative agreement stipulates that GMH provides dental services, GMH is unable to provide this service due to the unavailability of the dental clinic at the Manila Department of Public Health and Social Services, which was shut down. The dental services would include basic extraction with initial exam and x-ray prior to extractions and cleaning. The estimated cost per extraction would be higher charge if surgery is needed. Next slide, please. Overtime. The overtime level requested for DOC this year for its FY 2021 budget is $892,001. This may not be sufficient for the entire fiscal year. DOC's goal is to reduce overtime expenditures, but it will be reliant on current and future staffing. Due to the severe shortage of officers caused by resignations, retirements, and continued military deployment, DOC is on a 12-hour schedule with 5 days on, 2 days off. We anticipate an increase in overtime expenditures to previous levels. Note, currently, DOC is conducting a comprehensive staffing analysis based on the Department of Justice and National Institution of Corrections model, which is the first step to coming up with an overtime plan to mitigate our overtime issue. We have, next slide, our current projects. DOC's current ongoing projects are the DOC Master Plan. We have the PREA audit, the Corrections Officer Reserve Program, the Prison Commissary, the repair and replacement of fire suppression units at both the Hagåtña and Manila facilities, video conferencing at both Hagåtña and Manila facilities in conjunction with the Judiciary of Guam, relocation of the Parole Services Division to the former Hagåtña precinct, and a fence and service gate repair at the Hagåtña detention facility. This concludes my testimony. My staff and I are open to any questions from the committee regarding the department's FY21 budget requests as presented. Thank you.
Thank you, Director. I got a few questions. Based on a report provided by the governor regarding the coronavirus relief funds, DOC was approved funding of $2.2 million. Please explain what the funds will be utilized for and how this assistance impact your request for 2021.
For the most part, Senator, that is for mainly for programs and equipment, supplies related to the COVID-19.
Okay, when you say equipment, explain what you're talking about. Is it just PPE or is it masks?
Yes, PPEs.
Gloves? Okay.
Masks, gloves, spit masks, everything else that we need to equip our officers.
Okay, and that's gonna cost $2.2 million? That's to cover for what, the whole year and next year, or what? We just need to know, $2.2 million is a lot of money, Mr. Carrillo. So we just wanna know basically how does it help the department?
We actually presented, when we made the request, our application through, it was Bureau of Plans and Statistics.
Statistics and plans.
It was through a Bureau of Statistics and Plans.
Okay.
We submitted our request, and like I said, it was mainly, most of it is for equipment, supplies related to COVID-19, and that was the parameters that we were focused on.
Okay, and what's the amount of time that this $2.2 million worth of funding is supposed to cover you? Would it reach next fiscal year, Nate? Or you just look, it's only going to be good up to October and then that's it? You need more money? What?
We have up until December to spend.
We have up to December to expend all this money.
No, I'm not asking about spending it. If you get $2.2 million and you buy all the equipment you need to take care of your officers, because I expect that, and the inmates and everybody, how long will the supply last you? Or are you just buying just up to October? You see what I'm trying to get at? $2.2 million is a lot of money.
It depends on the wear and tear. We constantly have to replenish masks, especially, right? And not only are we expending that money on for masks and other hygiene supplies, it's not just for the employees, it's also for the inmates and detainees. And that's for about 600, 700 inmates and detainees.
Okay, let me go back then a little bit. When did you get the $2.2 million?
Was it July? When was it approved?
If either one of you can please just, I'm trying to make this very simple, okay? I don't want to make it hard. Everybody's getting money from COVID. You got $2.2 million, when did you get it? You just got it last week, a month ago, what?
It was in April or May.
It was in April and May, it's now July, okay? What have you spent of the 2.2? And I know that you're buying PPE, masks, and it's like wear and tear, understood. What has the expenditure been on a weekly or monthly basis? How far is 2.2 million going to take you?
For the majority of the 2 million, what we have done so far is, in order for us to use the 2 point that was approved by the governor's office, we have about $95,000 for reimbursement of what we had already expended.
Understood.
So we're going to submit our purchase orders and invoices to support that reimbursement. Just recently, we had done a requisition for the teleconference at the Hagåtña the new precinct for the judiciary. So we're waiting for the purchase order. That's about $50,000 that we have been approved for to use for the teleconference, and that would for the purchase of computers so that the inmates or detainees can communicate through Zoom. So we're in that process right now. So we're just waiting for a purchase order to be released for that. For the rest of the monies is all for, like what the director is saying, is for sanitation, not sanitation, but sanitary equipment supplies, for the mask, cleaning supplies, and that's for what was listed that we would need is like the replacement we use for the toilets. We had some renovations, post-7, especially when we thought that we were going to use it as a quarantine area. We had spent money on that, so I'm just...
How much?
I don't have the dollar amount, but I will give...
Okay, I just want the two of you just to understand. I'm only asking about the 2.2.
Right.
Get the total, what you're spending, because you've only addressed 144 million, 144,000.
Senator will get that total amount on,
Thank you.
on everything that we spend it so far. I don't have that with me right now, but
Okay.
we'll get all that for you.
and
I
just
know
go-
we can give you the detailed application that we submitted, and then we will include the total expenditures.
Okay,
thus far.
the reason why, Mr. Cabrita, I'm asking these questions because your oversight is going to ask you, if you got 2.2, as we go down the days, if we see a request for additional money, that you had money to use and you didn't use it, you're going to hear me say no. I'm going to tell you straight up, no. You had 2.2, you snooze, you lose, you caused the burden on your agency. You got $2.2 million, spend it. All I'm asking you to do is just list it down. PPE, you need 1,000. It's going to cost you 10, whatever it costs you.
Absolutely, Senator.
Just do what you need to
I
do.
agree.
Okay?
Absolutely.
I just want you working, okay? You're GPD, so you know where I'm coming from.
Yes, sir.
All right, now moving along, does your department have any outstanding retro employee salary payment as a result of the Competitive Wage Act of 2014? Do you have any employees that are owed, they get retro pay for increments, a Competitive Wage Act increase? Any impact? Any of your employees got an impact on that?
Yes, recently we received a letter from DOA that we have to cut a GG1. There are some employees that have already left the department like many years ago, but because of the Competitive Wage Act, there was the disparity in their pay. So we're seeking guidance from DOA and how our verbiage is going to be on the GG1, so we're going to,
All
for
right,
the director's
so you're
review.
working that already with BBMR and DOA?
We're going to be submitting it, yes.
Okay, do you know how much it could cost?
No, sir.
All
I'll
right.
get the dollar amount.
All right, thank you. In FY 2020, 2.5 million for consolidated agreement with GMH. I think you mentioned that. And it's continuing, right? Because that's a continuous, that's a 3-year contract you have with GMH, right?
No, that's the food services, the 3-year contract.
Okay, the consolidated agreement with 2.5 with GMH was funded through the Compact Impact Grant?
For 2020, yes, it
That's
was
for
funded
2020.
under Compact Impact.
Okay. Federal grants compared to FY 2020 federal program inventory. FY 2021 indicates federal funds from only for the State Criminal Alien Assistance Program. What is the status of the grants for residential substance abuse treatment and the Prison Rape Elimination Act programs that was reported in 2020? You have a status on those federal grants that you hopefully are able to get? Or
Yes, the RSAT, which is the Residential Substance Abuse Treatment Program, we're procuring supplies
Okay,
for the use of the inmates, like for their
Programs.
programs, like.
okay.
And then the PREA, we are already communicating. We're going to have the audit sometime late August, early September. So we're working with public health and how we can get our contractor in and not be quarantined so that they can just get down to business on conducting the audit with DYA and DOC.
All right.
Because they only have 2 weeks to conduct their audit here. So that's in the works at this moment we're scheduling it, trying to schedule it late August, September.
Okay, is there any other federal grants that might help the augmentation of your operations? Any other grants that are out there that you folks are reaching out and trying to see how you can, grab it for DOC?
At the moment, sir, that's all we have at this point. It's
Okay.
just the PREA and the RSAT, and that's through, we're sub-granted through Bureau of Statistics and Plans under the Department of Justice, OJP.
Okay. The revised staff pattern indicated 27 vacant positions, budgeted at 1.6 million, that were GG1 cleared. Do you have faith that they'll clear it so you can hire them and get your staffing up before September?
I've been on that every day, Senator.
Okay, so I'll help you out. I know Senator Terlai's going to help you out. We're going to reach out and ask them. Por favor, allow you to hire.
I am
Reduce
confident.
your overtime and get you moving.
I am confident, and I've been very diligent in trying to push those through a DOA.
All right, thank you. DOC's FY2021 request for fuel for DOC fleet vehicles increased by 96%, from 50 to 98,000. Could you please explain why the increase when we're doing a lot of virtual? I mean, we have to remember that this budget is pre-pandemic. So,
That amount for under the 240 object category under the Director's Office is not only fuel, it's for office supplies.
okay, okay.
Yeah.
It's not just for fuel, all right.
Yeah.
Contractual expenses on the Director's Office for FY 2021 decreased due to elimination of funding for the monthly reoccurring fees for PTT radios and maintenance of surveillance cameras. How will this be funded in 2021?
For which equipment again, I'm sorry?
Okay, contractual expenses under the Director's Office for 2021 decreased due to the elimination of funding for the monthly reoccurring fees for PTT radios and maintenance of surveillance cameras. How do you plan on funding that in 2021 if you reduced it in the Director's Office?
The Correctional Revolving Fund?
Okay.
Or we'll...
You have another source of funding it.
Yes, or we'll reprogram from other object categories.
Okay, we just
upon
got to make sure you
approval.
get lump sum so that you can adjust, right, where you need to. Okay.
Yes.
Facility upgrades. You have, what's the status of the RFP 001-2018 for technical consulting service for the preparation and establishment of a comprehensive facilities master plan? I think we talked outside about that. A
Yes,
new
the master
prison.
plan,
How does it look so far? Are we getting closer?
Yes.
that's already, I believe it was approved by the AG's office, and it's moving towards the governor's office.
All right. Hopefully we can hear possible groundbreaking, right?
It's a
Mr.
step in the
Cabrera?
right direction. Senator.
Sounds good. Public Law 3563 created the inmate commissary. I think you mentioned that in the budget about the commissary.
Yes.
Is there any money in the commissary fund right now?
No.
Not yet.
Not yet.
right?
We haven't implemented it yet, but it's in the works. We already have, again, that's down at the GSA, and it's moving.
Okay, and then you also have the reserve program that I know that we pushed with Senator Pito, 3564, the Civilian Correction Reserve Program. You guys are still looking forward, right?
Yes.
We're still looking, we already have, we drafted already a policy for that. There's just now the funding for it.
All right. I don't think I have any more questions. I just got to make sure you get a lump sum budget so you can manage how you need to work it. And I think
Yes, sir.
maybe you can reach out to the National Guard, the Army Reserve, and say, hey, can you slow down in deploying my people because you need to keep the prison running? Senator Pito, and then after you, Senator Amanda, and then Senator Tello. Thank you.
Thank you very much, Mr. Chair. I just wanted, and I want to thank you for covering most of the questions that I wanted to ask. Joe, I just wanted to kind of just clarify, are they working on your confirmation?
Yes, I've been going through the requirements, going a little bit slow because of the current situation that we're in, sir, but it's moving. I have one more requirement to fulfill. I'm scheduled for the last
The reason why I
appointment.
ask that, because usually when a senator chairs a certain committee, actually that senator is responsible to pursue the confirmation of any directors or whatever position there is. Joe, have you tested, is the DOC engaged in testing all the employees and the inmates at DOC? And if not, just give me a percentage of.
Yeah. Yes,
What is
so
that?
I know that that's been out there. Those questions are out there. Every time, we've had 2 positive cases. That's known already, right? In both cases, we conducted the proper protocol that's in place. We have our protocols that mirrors the Bureau of Prisons. I'm very confident in our policies and procedures that we have in place, including all the preventive measures that we have in place. Every time, for the last 2 cases that we had, we conducted our protocol, we notified public health, they did the contact tracing. The contact tracing for the last one is continuing. They've tested those that were a part of the contact tracing, that were identified as in the investigation, and they were all cleared. So the first time around, everyone was cleared and returned back to work. This time, again, I believe, from what I'm hearing, they've tested some officers, and they were cleared, and I believe they were cleared to come back to work as of yesterday.
But Joe, the officers, not all the officers have been tested.
No,
Not all the inmates have been tested.
no.
Okay, that's fine. That's what I wanted to know.
Um,
But
I-
if anything, Mr. Director, I would support that, you have everybody tested.
I will tell you, Senator, that the governor supports the testing, and we have been in communications with public health, and that's in progress.
Okay. The next thing that I wanted to ask you, because we had the bill on the commissary passed for so many months already, and I heard you mentioning that GSA is working on that one. Do you have an expected time frame where you're going to start the commissary program?
As soon as it clears GSA, sir, we're on it.
Have you communicated with the Director of Administration and the GSA regarding what is the holdup on that one? Because it's taking too long already.
Yes, we've been in constant communications with GSA. It just has to go through their legal process there. But I don't have a timeline yet,
The RFP, they have to work on the RFP.
and the RFP is probably going to take place right after that, once GSA clears it.
So have you gotten any time frame that thing will start?
No, Senator, but I'll get back to your office on when I can get a timeline for you on that.
Okay, because, that is not, the commissary program is not the only thing that I've addressed to the Director of Administration and GSA regarding the delays of the purchasing. One agency is the mass transit, and we're talking about 9 months to a year that they have requested, and, they're going to lose that federal funds. Anyway, Joe, how much money have you received from the CARES Act? Is that, Joe was talking about 2.2
Yes,
million?
2.2.
Is that the 2.2 million?
2.2 million.
Huh?
2.2 million, sir.
That's the CARES Act.
Correct.
Okay, you need to expend that right away.
Yes, sir.
Joe, several weeks ago, I received a call from a lady regarding, and I think you're familiar with this guy, Mr. Pablo at DOC. He is kind of just like coming down with Parkinson or something, very sick.
Yes, I'm familiar, sir.
And so what is the outcome on that one? Is there anything that is in the making to release this guy to the family because, he's very sick? And do you have the authority to release them? Because I thought you do have.
That is currently scheduled for a parole board hearing, sir. I can give you the actual date on that, but the parole board would have to hear that, and then we'll make the recommendation to the governor.
Oh, it has to go through the parole board?
Yes, yes, sir.
Really? Okay,
It's already scheduled.
okay. On the, is that 38 officers that were supposed to have been picked up by DOC? I know it's 30-some officers.
Are you talking about recruitment, sir?
Yeah,
We've recruited up to 51 on
31.
board right now. We have 51 on board.
but the actual numbers are like 38, right?
No, we have 51 on board.
31,
yes.
31, and that's the number you're dealing with right now? 'Cause I
Yes,
always thought
but
it was
not 35 are already actually on post.
Oh, okay.
The others are recruitment and are recruits that are ongoing, undergoing training, and then the remaining are still going through the interview process.
Okay, Joe, I talked to you several weeks ago regarding the spoil food, the complaint about the spoil food. What did you find out about that situation? What on the issue on that one? Because I asked you to check with. Remember, you told me that you need to clear with public health first before they can even go out there and do an inspection of the food. Did they do that?
Yes, we've since resolved that. We gave them replacement meals the following day. Although the food was inspected and it was deemed not spoiled, I still directed my staff to make arrangements with the food services vendor to provide replacement meals. No one was sick, though.
Okay, good job, Joe.
Yes.
I just want to say that your presentation for this budget is really sound, and my record at the office really reflects that you're making use of the money and that some of the issues that has been raised. So I just want to thank you for your presentation. It's a good presentation. I would say it's complete. And there's some, as a matter of fact, the chairman of the committee, or Mr. Chair, has mentioned that you need to use that money.
Yes.
Because if you don't use the money, especially those from the federal funds, there's a timeline for that.
Duly noted, Senator, and we will for sure make sure that we use all that money.
Okay, Joe, thank you very much.
Thank you.
Thank you very much, Mr. Chair.
Thank you, Senator Terlai. Senator Amanda, do you have any questions, ma'am? And you're followed by Senator Tello.
Thank you very much, Mr. Chair. Thank you both for being here today and your team who's outside to answer any of our questions. I appreciate it and all the work that you continue to do. I have a question regarding the dental services, which was mentioned in your presentation tonight. So you are requesting $60,000 as supplemental funding for dental services because you don't have the facilities in your Manilao facility, and the Manilao Public Health and Social Services was recently shut down. So since that time that DPHS shut down in Manilao, where have inmates been receiving dental service?
So we've just been doing what do we call it? Purchase orders, right?
Because of that situation, through the director's instructions, I had prepared a requisition through GSA it's like a blanket purchase order, asking for at least several vendors if they can provide at least some services. So I'm just waiting for GSA to clear my requisition and a response from the 2 vendors or 3 vendors that I have reached out to. So we're just pending response from them.
Okay. So since the time the Manila facility shut down a few months ago, there's been no dental emergency that's needed immediate response, and there's been no dental services at all?
Just a one-on-one, I think.
I think we had one, and we took care of it by,
It was a one-on-one, depending on the nature of the service that had to be done. I believe it was approved to go out to one of the clinics,
Okay.
but
so it's on a as needed basis. So whenever there's something very urgent, then we do get the scope of work, and then we procure it.
Okay. Thank you very much. So now this $60,000 will be used for individual contracts with private clinics then?
Yes.
Okay.
Correct.
And so was this $60,000 taken into account when negotiating the consolidated agreement with GMHA? Because
No.
that
So-
was something that they were going to provide service for if you had the facilities.
So part of the agreement on that agreement with GMHA, I didn't discover until later on that they didn't provide dental services, of course, right? Because they're a medical facility. So they did an amended version of the MOA so that public health would provide it. But unfortunately, public health got shut down because it was on fire. So since then, it was public health that was providing it based on the MOA. And then when it burned down, we had nowhere to go. So we've been doing small procurements based on an as-needed basis.
Okay.
Senator, I think the amount out of 60,000, it was one of the providers that wanted to do service just gave us an estimated cost. So we took it at $5,000 for 12 months, so that we'll figure out if that would be enough. So.
Okay, so this $60,000 is really only for emergency services. There's no regular visits or cleanings that is included in this amount. This is just specifically for X-rays and needed extractions.
Yes.
Okay,
Yes,
so
ma'am.
emergency situations.
Yes, ma'am.
Okay. Okay, thank you very much. I just want to ensure that there is somewhere that the inmates can go for that service, and there's no one that's suffering with some
Yes.
extreme pain and it's being
I
taken
agree.
care of. Okay, thank you very much. My second question is about overtime. I know that you did talk about overtime in the budget, but I want to know if any of this is from previous years or this is all for your budgeting for the current year. Is anything for past overtime?
So your question is, you're asking what we have now currently?
Is there any employee of the department who is still owed overtime for any past year?
Oh, no.
Okay.
We're up
No.
to date.
Okay,
We've been
very
keeping
good.
update.
Okay, that's
Yes.
good to hear. Thank you very much. And so I know you talked that you will be giving us some specific information of how you're using the CARES Act funding, and I appreciate that. But I want to know how you are distributing PPE right now to both the staff and the inmates. So are inmates also getting face masks and other?
Yes,
Okay.
that's part of the mandatory directive that I put out. So all inmates, detainees, and employees are required, they're mandated to wear face masks.
Okay, very good. So are they disposable face masks? Are they reusable face masks? And how often are they getting them?
They're disposable and they're issued on a weekly basis.
Okay, so one mask per inmate per week.
One or two, it depends on the supplies that we have, but I think we have more than sufficient enough supplies. So I believe it's between 1 to 3 a week.
Okay. And I imagine there's really no means of social distancing when there's multiple people within a cell. Are there any other precautions that you are taking or any change in procedures?
Hygiene.
Okay.
We constantly have them clean the area, where the living areas that they're in. We provide them with all the supplies that's required to maintain proper hygiene. Hand sanitizers, cleaning supplies. So those are constantly issued on a weekly basis.
Okay, thank you very much. I know the department is already very overburdened and overpopulated, and we'd hate to see any kind of outbreak within the facility, so I'm glad to hear of the precautions that you're taking. A couple of months ago or a few weeks ago, we did hear some complaints about the food, which Senator Pito mentioned. You know, they did come to our office, so I'm also happy that that's been addressed. And are we still going to use the same vendor, keep the same contract in the next fiscal year?
They're contracted for 3 years.
Okay, and so that will end?
That just started this year. They were just issued the contract this year, so this year and 2 more years.
Okay, thank you very much, and thank you, Mr. Chair.
Thank you.
Thank you, Senator Shelton. Senator Talatari, do you have any questions, ma'am?
Mr. Chair. Hafadi Joe and Ms. Nauta, right?
Yes.
Yeah,
Hafade,
thank you
ma'am.
so much. You know, I always hate to be the person coming between you and dinner, so I'm going to try to be as fast as I can so you can get home to dinner.
No worries, Senator.
But you know, Joe, you've been here for a while. I mean, you've got, how many directors have we had up there so far? It's been, I know it's been very difficult to try and find some kind of foundation and stability up there. And if anybody, you know, I see you holding it together over there. I just wanted to thank you.
Thank you.
And I do know that Mr. Camacho, Bob Camacho, what is his
Yes.
capacity there?
He's the deputy
He's now the
director.
deputy? Okay. You got a good guy there.
Yes,
You know,
I agree.
Yeah, I think that's why things are starting to go smooth now,
Yes.
just having that right-hand person to try to move things forward. And I greatly appreciate him too as well. I know he's a very hardworking individual.
Yes, ma'am.
And so, you know, of course, the overtime is always a concern. I'm glad to see you're up to date. It's good to know. Are your allotments coming in on time, by the way, Ms. Nata?
Yes, they are.
So you're up to date on your allotments too as well, no?
Yes.
Now, Joe, every time that, and Ms. Nata, overtime has always been an issue at DOC. And you ask for a certain amount of money for salaries, but then at the end of the year, there always seems to be, additional funding that you're short. How short were you in FY19 for overtime? How short?
We always exceed the amount that's appropriated by double.
By double, right?
Yes.
Okay. So do you anticipate in 2020, yeah, this is a big thing, Joe. I'm talking about Joe, our oversight of OFB. That's always a big issue. And that's something that we need to get ahead of the game on this and not put you guys in a debt like you have been every year. So FY19, it's almost doubled. We're coming on in 2020. And with all the, I was hoping some of the CARES Act funding would incorporate somehow, because I know that you requested the funding from the CARES Act, and it had to be in relation to COVID and the issues that come about, right?
Yes.
I know that the facility was one thing, technology. Those are the two as high price tags that you have. You know, all the other stuff on masks and gloves are different. It's those two high price tags. I don't know if you can, but if you can find some way that that money was used actually could be used to cover some of the cost associated with COVID with regards to overtime and the issue that you always have every single year with exceeding the amount that's been requested, okay?
Yes.
Yes.
So, and I know you have an opportunity, a second, I don't know if it's already passed. I believe there was a second window of opportunity for CARES Act money. It might have already slipped away, but I know they've been making, the governor's a budget for $117 million. They've been making adjustments here and there.
Yes.
So, look into that one for
Yes.
for that. I'm glad to hear but the allotments are coming in. But like I said, even though you have your allotments, you guys have always been exceeding your budget
Yes,
on
ma'am.
salaries. So hopefully we'll work on that. And you know, it's not just the able to pay it, but my biggest concern too is the safety of your police, of the correction officers that are there, extending way too long, you know, with overtime.
Yes.
It's a safety issue. And we got to be really concerned about that more so than anything else. And I know that Bob is very well versed in combining the two of you together. I'm sure you guys are keeping that on top priority, the safety of your officers.
Yes, ma'am.
Okay. I didn't see anything on capital improvements, and we all know that DOC is in desperate need of a new facility. It's been that way for years. And every year we come back here, I don't see anything happening with improving your capital improvements for your facilities. Is there anything in here that is going to at least put some aside to address that, or to work with HUD, or work with GURA?
I think maybe you want to talk about the groundbreaking that hopefully it'll pass and you get a new prison, Joe?
Bravo. That's what I
So
want to see.
the master plan, like I told Mr. Chair
Yeah.
earlier, that's in the works already, and that's the first step to having a new prison. I know it's a long ways, but this is the furthest that we've been.
Okay, that's good. Have you put any money aside for this? Have you incorporated into your budget?
The master plan is paid for by a DOI funding.
Okay.
Department
But
of
then
Interior.
after DOI fund, and I mean, you got to put a little, it's like anybody, like a young couple just getting married. They
Yes.
put some money aside every year so they can buy their house, you know,
Yes.
and that's what DOC needs to do. You need to find some way to incorporate funding in here to set aside to build that new facility. A nice 2-story, well, top-rate, safe facility for both the inmates as well as, you know, your correction officers. Were you going to say something, Ms. Nauta?
Actually, we are going to, I think we had been communicating with Guam State Clearinghouse in assisting us in getting technical assistance, but we were working with the master plan, so I think that will be in the works in the long run.
Okay. Well, let's make it shorter than a long run. Let's make it a short run so that we can get up and running on that new facility, because if not, then what's going to cost us is called a receivership.
Right.
That's
Yes.
what's going to happen. And if a receivership comes in to tell us how to build a new facility, shame on us.
Yes.
It's already happened once to the dump. Let's not let it happen again. And close to the injunction over at mental health as well, behavioral wellness. Let's not let that happen to DOC. You got two great minds there, and now to there. Let's work on that, okay?
Yes, ma'am.
Okay, that's my biggest concern with regards to that. Okay, I'm good. Mostly everybody else has answered the questions. I really appreciate it. Like I said, I don't like to be between you and dinner. So,
Thank you, Senator.
be safe out there. Wash your hands.
Yes.
Alpha?
Thank you.
Okay. Mr. Chair. Thank you.
Thank you, Senator Tello. Being that all the questions were asked by my colleagues and you've answered them, and we actually really look forward to hoping that as we go through this budget process, we are able to find the funding to be able to support you, because you know you got your folks out there. You got Colonel Algan out there. You got Primon Robert Komatsu. You got Chelo Mike Kinata. You got the Diamond Glue family. The
Yes, I
doctor
have
out
good
there.
people.
You
I
got a
have
good
good
crew,
people.
Joe.
Yes.
Just keep them on. Keep them working. You know what I mean?
Yes.
And I'm happy they're listening, because they're all good people. You have good people up there. And being short on funding doesn't help you. It just makes your job harder.
Yes, sir.
But we'll see what we can do. And then your parole chairman is the OFB chair, so director. So you're in luck. There being none, the committee will conclude this budget hearing with the Department of Correction. The committee will continue to receive testimony. Please address your written testimony to the Committee on General Government Operations, Appropriation, and Housing, and submit it via email to Senator Joe S. Augustin at gmail.com. Si Zeus Masi for attendance and participating in today's hearing. And for those at home, thank you for watching. This budget hearing on Bill 282-35, relative to the Department of Correction, is now adjourned. It is 6:11. Have a nice evening. Thank you, sir.